A lot of parents are asking, is it safe for my child to go back to school?
Well, it's a very good question. When you make a decision about going back to school, you have to look at the benefits of going back to school. And there certainly are benefits from the social, mental, and physical well-being of your child. You have to weigh those benefits versus the very, very small risk of COVID-19 in our community at present. So in my estimation, the social, mental, and physical well-being factors way outweigh the risk of COVID-19. But you can also do an assessment. So you can look at your child and do a risk assessment. Look at the individual health issues of your child. So if they have any underlying condition, whether it's related to the lungs or the heart or the immune system, you could discuss that with your healthcare provider and get an opinion whether COVID would make these underlying health issues worse or pose a risk to the child. And that's an independent consideration with your healthcare provider. You could also look at your family structure, whether there's grandparents at home that could be exposed if your child brings COVID back, or whether there's someone else in the house that has health issues related to these factors as well. So look at your social and secure bubble, whether a child could potentially bring a virus back, and also look at your child's underlying health issues. For the vast majority of children that don't have any underlying medical illness, it would be very safe to go back to school. You then look at the community status. Is there spread in our community of COVID-19? Is the spread in my neighborhood, in my school, or in that setting? And that information is available at KFL&A.ca. We're updating new cases of COVID-19 on a regular basis. There's also a map so you can look at where you live and where your school is to see if there's been previous cases in that environment. And certainly going forward, you'll be able to see new cases identified. We will get new cases. We hope to be able to control them very quickly, and we've built up increased infrastructure to be able to control the spread of COVID-19 in our community. So do your risk assessment, assess the health of your child, your family, look at the community status where we have no activity in the community whatsoever at present. And then if you've made a decision that your child should go back to school and get the social, mental, and physical benefits, then monitor your child's symptoms every day. So before they get on a bus or before they go to school, screen for any symptoms of COVID-19, such as fever and or cough and or increased shortness of breath or any respiratory symptoms. And don't go to school. Contact your healthcare provider if they have symptoms compatible with COVID-19. Monitor the symptoms at school. So if your child does develop symptoms compatible with COVID-19, they will be isolated from other children, and the parent will be called regarding the symptoms and getting them assessed. To prevent any significant exposure, mask where required, have good hand hygiene, continue to practice physical and social distancing, and on the bus, wash your hands before you get on the bus and after you get off the bus. And we worked with the school boards. We know children will be staying in the same seat, in the same location. So if we have to do contact tracing, we'll be able to inform those that potentially were at risk if someone went on the bus with COVID-19 symptoms. So these precautions are the essential precautions that we have to educate children to maintain. And we know there's going to be differential uptake based on age, but these are the basic tenets that will keep us all safer as a community. If we maintain low community transmission of this virus, it will have a direct benefit to the safe opening of our schools. So we're all in this together. Again, everyone has a role to play. And if we all embrace these precaution activities, we will continue to be a very safe and low-risk environment for COVID-19.